Attention seniors, something major just happened that could change how much you pay for your medicine. A newly signed executive order is targeting the enormous gap between what Americans pay for drugs and what other countries pay for the exact same pills. A 72-year-old woman named Barbara from Atlanta, Georgia, was spending $1,521 every single month just to stay alive on her medications. That's more than most seniors bring home from Social Security in a month. Under this new pricing order, her annual drug costs could drop from over $18,000 a year down to just $2,736. I'm going to break down exactly what this means for you and what you need to do right now. My name is Robert Calloway, and I've spent more than 2 decades helping seniors understand and navigate their Medicare benefits. Today, I'm giving you the clearest explanation of this new drug pricing order you're going to find anywhere. Everything I cover is based on what the order actually says, not spin from either direction. Here's what separates people who protect their money from people who lose it: access to timely information. You're watching this video, which is a good sign. But if you're not subscribed, you'll miss the next update when more drug prices start dropping. Fix that right now. Hit the subscribe button before we go any further. Don't let the next piece of critical information slip past you. Let me explain the problem that's been building for decades. Medicare right now pays whatever pharmaceutical companies decide to charge. And those companies charge Americans far more than they charge people in other countries. The exact same blood thinner that costs $82 a month in Canada costs $570 a month here in the United States. The same diabetes injection that costs $155 in Japan costs more than $2,100 here. This isn't because the drugs are made differently. It's the same formula, the same manufacturer, the same medication. The price is higher here because no one was pushing back. Other countries negotiate directly with drug manufacturers. Their governments say, here is what we will pay, take it or leave it. American Medicare was actually prohibited by law from doing that same negotiation. That law kept seniors paying inflated prices for years, while pharmaceutical company profits soared. It kept you overpaying, while the same drug was sold cheaper everywhere else on Earth. The executive order that was just signed changes that dynamic completely. It directs federal health officials to identify the lowest price any comparable wealthy nation pays for a specific drug. That price becomes the new target for what Medicare pays going forward. If Germany is paying $38 for insulin and Americans are paying $370, the new target becomes $38. This is not a law passed by Congress. It's an executive order, and it has been signed. The drugs that will see the biggest impact are the ones seniors depend on most every day. Insulin for diabetes currently costs many seniors between $350 and $400 a month under Medicare. The target price under this order is $35 a month, which is a savings of over $300 every single month for millions of people. Blood thinners taken by seniors with atrial fibrillation and heart conditions currently run $480 to $610 a month. The comparable international price for those same drugs runs $75 to $110 a month. That is a potential monthly savings of more than $400. Biologic injections for rheumatoid arthritis are some of the most extreme price gaps. These drugs cost between $3,900 and $6,100 a month in America right now. In Germany and Japan, the same biologics run $800 to $2,350 a month. Diabetes drugs that also protect the heart currently cost $520 to $640 a month in the U.S. International comparable prices run $85 to $120. Cancer treatment drugs administered in doctors' offices cost seniors $2,100 to $3,500 per treatment here. The international price range is $500 to $900. Let me tell you about Barbara. She is 72 years old and lives just outside Atlanta, Georgia. She spent 34 years working as a school librarian before she retired with a modest pension and Social Security. She was diagnosed with type 2 diabetes 8 years ago, then high blood pressure, then her cardiologist found an irregular heartbeat. She takes 4 prescription medications every single month to manage these conditions. Barbara's insulin costs her $370 a month. Her blood thinner costs $545 a month. Her combination diabetes and heart pill costs $595 a month. Her blood pressure medication is a generic and runs $11. Her monthly medication total comes to $1,521 every month. That adds up to $18,252 going straight to the pharmacy every single year. Barbara's combined Social Security and pension income is $2,120 a month. Her medications are consuming 71% of everything she brings home. Her daughter noticed something troubling 6 months ago. Barbara was cutting her blood thinner tablets in half to stretch her supply. She had been doing it quietly for over a year without telling anyone. Her cardiologist told her that was putting her at serious risk of stroke, but she genuinely couldn't afford the full dose every single day. Under most favored nation pricing targets, Barbara's insulin would fall to $35 a month. Her blood thinner would drop to $88. Her combination pill would go to $94. Her blood pressure generic stays at $11 since it's already a generic. Her new monthly total would be $228. Her new annual total would be $2,136. That is an annual savings of $15,806. When Barbara's daughter sat down and explained what the new pricing order could mean for her, Barbara went quiet for almost a full minute before she could speak. Quick pause here. What state are you watching from right now? Drop your state name in the comments below. Drug assistance programs differ significantly depending on where you live, and I want to make sure I'm covering what's actually available to you. Your comment also helps the algorithm show this video to other seniors in your area who need this information just as much as you do. Type your state in the comments right now before we continue. Here's the honest reality about this executive order. It's been signed, but full implementation doesn't happen overnight. The first phase covers the initial 30 to 60 days. Federal health officials are identifying drugs with the largest price gaps between the U.S. and other countries. Insulin is expected to be prioritized in the very first wave. The second phase runs from 60 to 180 days. Officials begin implementing new pricing for high-cost drugs given in doctors' offices and hospitals, including cancer treatments, biologic injections, and eye medications for macular degeneration. The third phase extends from 6 to 18 months. Pharmacy pickup drugs like blood thinners and diabetes medications begin pricing changes through Medicare's prescription drug plans. This is a phased rollout, not an overnight switch, but the direction has been set, the order has been signed, and federal officials have been instructed to move. Here's what frustrates me about this entire situation. Drug companies are already preparing legal challenges. They will claim that lower prices threaten future medical innovation. They will argue that fewer profits mean fewer new treatments being developed. But here's the reality they don't want you to sit with. Germany still gets every new drug. Japan still gets every new drug. France, Canada, Australia, and the United Kingdom all pay dramatically lower prices. All of them still have access to the same cutting-edge medications Americans take. If lower prices killed innovation, those countries would have outdated medicine. They don't. This makes me genuinely angry on your behalf. You worked your entire life, paid your taxes, paid into Medicare faithfully. Now you're rationing pills at your kitchen table because a profitable corporation decided your suffering was less important than their quarterly returns. Other countries pushed back and said no to that arrangement decades ago. America's seniors have been paying the price ever since. Let me tell you about William. He is 69 years old and lives in Denver, Colorado. He spent 28 years doing construction work before his joints gave out completely. He was diagnosed with severe rheumatoid arthritis at age 65. His hands and knees deteriorated quickly and became debilitating. His doctor prescribed a biologic injection administered at a clinic every few weeks to manage his inflammation and pain. The drug William takes is covered under Medicare Part B, not through a pharmacy. It gets billed as a medical service during his clinic appointments. The drug costs $5,200 a month. Medicare covers 80% of approved costs. That leaves William responsible for 20%, which comes to $1,040 every single month for just this one medication. He reaches Medicare's catastrophic coverage threshold during the year, but the annual financial damage is still enormous and ongoing. If most favored nation pricing brings William's biologic down to an international comparable price of around $1,250 a month, his 20% co-insurance drops from $1,040 a month to $250. That difference is $790 every month. Over a full year, William saves more than $9,480 on this one drug alone. He told his son he has been putting off replacing the hot water heater in his house for 2 full winters now. Every spare dollar has been going directly to those clinic bills. Real quick, if this video is giving you useful information right now, please hit the like button. The algorithm uses like ratios to decide how many people it shows a video to. More likes means more seniors find this information while they can still act on it. It doesn't cost you anything, and it takes about 2 seconds. Like this video now and help get this information to more people who are in the same situation as Barbara and William. Now let me tell you about something that doesn't require waiting for any court decision. If you take insulin and you have Medicare Part D, there is already a law in place that caps your insulin copay at $35 a month. That cap has been the law since early 2023. A significant number of seniors are still being charged more than that right now. If you're paying more than $35 a month for insulin today, call your Part D plan this week. They may be billing you incorrectly and have been doing so for months. Let me tell you what happened to Nancy. She is 74 years old and lives in Charlotte, North Carolina. She has had type 2 diabetes for 11 years. She had been paying $310 a month for her insulin every single month without questioning it. She had absolutely no idea the $35 cap already existed as law. Her neighbor mentioned it in a casual conversation last summer. Nancy called her Medicare Part D plan the very next morning. They confirmed she had been overcharged for 19 consecutive months. She received a credit of $5,225 applied to her account. That money was restored within 30 days of her phone call. One call, over $5,000 recovered. Here is exactly what you need to do. I'm giving you 5 specific steps. Each one is something you can actually complete this week. Write these down or pause the video when you need to. Start with step 1 before the end of this week. These steps work right now, regardless of what happens with the courts or the implementation timeline. Step 1. Sit down this week and make a complete written list of every medication you take and what it costs you each month. Include drugs you pick up at the pharmacy, drugs administered at a clinic, and anything that gets mailed to your home. Add up your total monthly cost and write that number somewhere. You'll find it later. That number is your baseline. When prices begin dropping under this order, you will know exactly how much you are saving compared to where you started. Keep that number handy every time you call your plan or your doctor's office. Step 2. If you take insulin, call your Medicare Part D plan this week and ask directly what your monthly copay is under the current insulin cap law. If they give you any number higher than $35, ask them to explain why and request an immediate billing review of your account. Plans are legally required to honor that cap. Some seniors have received refunds covering more than a year of overcharges just by making this one phone call. This has nothing to do with the new executive order. This is money you may already be legally owed right now under existing law. Step 3. Look up your eligibility for Medicare's Extra Help Program, which is also called the Low Income Subsidy or LIS. If your prescription drug costs are eating up more than 5% of your monthly income, there's a real chance you qualify for this program. Extra Help can significantly reduce your Part D monthly premium, your deductible, and your co-pays at the pharmacy. This program exists independently of the executive order and is available right now. Visit ssa.gov or call 1-800-772-1213 to check your eligibility and apply. Don't wait for any court ruling before you look into this option. Step 4. Search online for Cost Plus Drugs or GoodRx this week and look up your specific medications by name. Cost Plus Drugs prices, medications at the actual manufacturing cost plus a small fixed margin. Insulin is already available through that platform at $35 or less right now, and no executive order is needed to access that price. GoodRx shows you the lowest price currently available at pharmacies near your home. Many seniors discover they can cut their drug costs by hundreds of dollars a month just by changing where they fill their prescriptions. Always check with your doctor first to confirm that switching is appropriate for your specific medical situation. Step 5. Call your Medicare Part D plan or your doctor's billing office and ask directly whether any of your medications have been announced for price reductions under the Most Favored Nation pricing order. Some plans may begin updating prices ahead of the federal deadline in order to stay competitive in the market. Ask them to flag your account so you receive automatic notification the moment any of your drugs see a confirmed price reduction. You want to know about that the day it happens. Ask them to put the request in your file right now during this call so there's a record of it. Think about someone in your life right now who needs to hear this. A parent, a sibling, a close friend, a neighbor you see at church or in the yard, someone you know personally who is struggling to pay for their medications every single month. Share this video with them today. Text them the link right now before this video is over. Don't put it off until later tonight or tomorrow. Do it right now while they're on your mind, because later has a way of never arriving. While you're waiting for the federal order to take full effect, your state may already have programs running that can help right now. Approximately 30 states operate what are called state pharmaceutical assistance programs. These programs exist separately from Medicare Part D and can provide additional coverage layered on top of what Part D already provides. Some states will cover 100% of drug costs for qualifying seniors below certain income thresholds. To find out what your state currently offers, visit Medicare.gov and look for help paying drug costs, or call 1-800-633-4227 and ask specifically what state-level pharmaceutical assistance programs are available where you live. Every major pharmaceutical manufacturer also runs its own patient assistance program. These programs provide free or deeply discounted medications to people who qualify, and many of them include people who already have Medicare coverage. If you're struggling to afford a specific drug right now while you wait for federal prices to change, call that drug's manufacturer directly and ask about their patient assistance program. Income thresholds for these programs are often much more generous than people assume. You might qualify even if you've already assumed you earn too much to be eligible. These programs exist right now with no court approval required. If this executive order is fully implemented and withstands legal challenges, the impact on seniors would be historic. Average out-of-pocket prescription costs for seniors have increased dramatically over the past 4 decades. Social Security cost of living adjustments have never kept up with prescription drug price inflation during that same period. Millions of seniors today skip doses, cut pills in half, and delay refills, not because they don't understand their conditions, but because they genuinely cannot afford to manage them properly. The medical consequences of that are serious hospitalizations, preventable complications, and a shorter, harder life. William from Denver told his son something during one of his clinic visits that has stayed with me. He said that every time he sits down in that waiting room, he does math in his head. He runs the numbers on whether the bill at the end of the month will still leave him enough for groceries and utilities. Nobody should be spending their retirement years doing arithmetic about whether they can afford to stay alive. Nobody who worked 3 decades and paid faithfully into the system should ever have to make that calculation sitting in a medical chair. Let's review what we covered. A newly signed executive order is directing Medicare to stop paying prices that are 3 to 5 times higher than what other wealthy countries pay for the exact same drugs. Seniors taking high-cost medications could see annual savings ranging from several $1,000s to over $15,000, depending on their specific drug regimen. The order has a phased implementation timeline, and legal challenges from drug companies are fully expected. But there are powerful cost reduction tools available to you right now today that don't depend on any court ruling going a certain way. You came into this video overpaying. You're leaving it with a real plan. Barbara in Atlanta could go from spending $18,252 a year on medications down to $2,736. William in Denver could save more than $9,480 a year on a single biologic drug. Nancy in Charlotte recovered $5,225 in insulin overcharges with one phone call to her Part D plan. These outcomes happen when seniors understand their rights and take action. The information is out there. The programs already exist. What too many people were missing was someone willing to explain it clearly and directly. That is what this channel is here to do for you every week. If this video helped you today, here's what to do next. Subscribe to this channel so you catch every update as this situation develops in real time. Hit the like button so the algorithm pushes this video to more seniors who need it just as much as you did. Share this with someone you care about who is struggling with their drug costs right now. Drop a comment below with your state and whether any of this applies to your personal situation. I read comments regularly and respond when I can. Every comment and every share helps other people find this information when they need it most. Important disclaimer: everything covered in this video is for educational and informational purposes only. It is not legal, financial, tax, or medical advice of any kind. Every person's situation is different, and drug coverage rules vary significantly by state, by plan, and by individual circumstance. Before making any changes to your medications, your insurance coverage, or any financial decisions based on this content, please speak with licensed professionals including your personal doctor, a licensed pharmacist, a certified Medicare counselor, or a qualified financial advisor. What applies to one person's situation may not be appropriate or accurate for yours.